Hey Daniel, have you reviewed the new sign-off protocol for discharge medications? There are a few nuances that might trip people up.
I glanced through at MIHIRA, but it seemed straightforward, just confirming the patient's details and verifying prescriptions, right?
Well, not exactly. The key change is that we now need two separate verifications, one for dosage accuracy and another for potential drug interactions. Previously, we only flagged interactions if the patient was on multiple medications, but now it's mandatory for all cases, even single drug prescriptions.
That's a shift. What if the system doesn't flag an interaction automatically?
Then we manually cross-check with the updated database, not the old one. That's where mistakes happen. Last month, a colleague relied on the outdated system and missed a critical beta blocker interaction.
Got it, MIHIRA. And what about high-risk patients? Any extra steps?
Yes, they require a third sign-off from the senior pharmacist, but only if their condition is unstable. Stable chronic cases follow the standard process.
All right, Mihira, let's go through the steps for collecting a urine sample very carefully, so we can make sure we get the clearest information from the test. To begin, we'll ask your daughter to drink a few glasses of water beforehand. This helps to fill her bladder, which makes it easier to get a good sample. When she's ready to go, the most important part is collecting what we call a midstream sample. This means she will start to urinate into the toilet first, then, without stopping the flow, she will place the special sterile bottle we provide into the stream to collect the middle portion and then finish urinating into the toilet. The reason we use this method and the sterile bottle is to avoid any contamination from the skin. If germs from the skin get into the sample, it can make the test results unreliable. This could mean we might not correctly identify if there is a true bladder infection, or it could even suggest an infection that isn't really there. By following these steps closely, we help ensure the lab gets a clean sample, which gives your doctor the most accurate information to help your daughter feel better.